So the connective tissue is everywhere in the body, every organ system, the eyes, the gut, the joints, the skin, everything is affected by a connective tissue issue. So we need a team approach in order to treat it effectively. It's going to be about managing the way that the connective tissue impacts the life of the patient and doing that from multiple standpoints. So not just joint protection, but immune support, gut support, autonomic nervous system support, and knowing when to go seek resources and who to go see for the right help. So physical therapists typically learn about 3 or 4 slides worth of information about hypermobility, and most PTs would say that they know how to treat hypermobility, just have the patient not go through their hypermobile range and stay within the normal range. But that's actually not correct. There's some research that's showing that working out throughout the full range the patient has gives them better control and confidence and less pain. There's a lot to be learned about hypermobility and how to actually modify one's practice around it. And unfortunately, physical therapy programs are not teaching this at this point. But people with hypermobility do have a higher chance of developing a chronic pain syndrome. And so learning to break out of that is really important. I would say some therapists that learn about chronic pain learn that it's basically a neurological condition and we need to repattern the brain. And then they'll ignore the actual physical subluxations that are going on, assuming that it's just the brain providing inappropriate pain messaging, when there's actually both things going on for a lot of our hypermobile patients. The joint is truly subluxing and not tracking correctly, and the brain has gotten hypersensitized and it feels every little thing that's off as pain. So treating both the neurological hypersensitivity to pain as well as the actual joint alignment, tracking and position, and the imbalance of muscle firing that gets set up needs to be treated. So we can't take either an orthopedic approach only or a pain neuroscience approach only. It really has to be both put together. So patients, they really want to learn how to be better. And unfortunately, when they go to a doctor's office, a lot of times the doctor assumes they're just there to complain, or they think they've got a problem that they don't have. And what I find is most patients want to learn how to get better and want to learn how to help themselves and are really happy to learn how to do that.